Hi everyone, I'm Nathan Davis. I'm a public speaking student at Blaine Community College, and today I want to talk to you about unplanned pregnancy and birth control. According to Vice Chair Carolyn Maloney from the U.S. Congress's Joint Economic Committee in October 2015, access to family planning reduces poverty, it helps save taxpayer dollars, it also increases the chance that women will pursue further education, and helps women stay in the workforce longer. Rates of unplanned pregnancy, unfortunately, have remained the same since 1983, although that family planning benefits and access has become widely more spread in the last 30 years. A little bit about me. I'm a paramedic, and I often see women who are dealing with unplanned pregnancies, and I can see how it affects the patient, their family, and the medical system. Because of that, I wanted to talk to you today about the importance of family planning and access to family planning. Better education and availability leads to better decision making. It's that simple. We want to give more access to women so they have better access to birth control and can make better opportunities with their family planning. First, we're going to look at the statistics of unplanned pregnancy, the numbers that go along with it. Then we're going to talk about some popular birth control methods. And lastly, considerations when choosing birth control. So, whenever looking at the statistics of unplanned pregnancy, we want to look from the top down to understand where the issue is at and who needs better access and education. According to the National Health and Statistics Report released by the Center for Disease Control in 2012, 37% of pregnancies in 2011 were unintended. Of those, 13.8% were unwanted. This is within the same number of statistics published in 1983, showing that while we've made a number of steps, we still have a long way to go in giving women access to family planning. Whenever you look at it by age, 78% of pregnancies are unplanned in 15 to 19-year-olds, 50% of pregnancies are unplanned in 20 to 24-year-olds, and 25% of pregnancies are unplanned in 25 to 44-year-olds. This shows that age makes a big difference, and the younger generation has a lot less education whenever it comes to access to birth control and the importance of it. When looking at levels of education, if you had less than a high school diploma, unplanned pregnancies occurred 23% of the time. Whenever you had some form of college classes, it only occurred 12% of the time. Those with bachelor's degree and higher, however, only had unplanned pregnancies only 4% of the time. This shows that we need to be giving better access to family planning and birth control to those who are in high school and middle school so that they can understand the implications going as they further their education. Whenever women were asked why reasons the birth control was not used, 36% of women reported they did not think they could get pregnant. 14% of women worried about the side effects of birth control, and 13% reported that men didn't want them to use the birth control. These are all statistics from the National Health and Statistics Report released by the CDC, and shows that we need to be given better opportunities and better education to these women so they can understand the importance. Now that we've talked about some of the statistics and the reasons that women don't take birth control, I want to discuss some of the birth control methods that we can use. Condoms are the most popular. They're either going to be latex or plastic, sometimes lambskin. It goes over the penis and keeps sperm from going into the vagina. Out of 100 couples that use condoms daily for a year, 18 of the women will become pregnant within that 1 year. Condoms, it's worth noting, are the only form of birth control that protect against STDs such as herpes, gonorrhea, syphilis, and HIV. And these facts are straight from the Planned Parenthood's birth control fact sheet released in 2019. Oral contraceptives, while cheap and more effective than condoms, they contain balances of hormones such as estrogen and progestin. They prevent sperm from joining an egg and prevent ovulation. According to Planned Parenthood birth control fact sheet released this year, when used perfectly, birth control pills are 99% effective. Lastly are the intrauterine devices. They're small T-shell plastics. They fit inside the uterus and they prevent sperm shells from ever reaching an egg. There's less than a 1% chance of pregnancy when using an IUD, and they're more effective than birth control due to decreased error, as women don't have to worry about taking it daily at the same time and worry about refilling prescriptions. So whenever you're choosing your birth control device, you need to know that there are negative side effects and consequences for the use of each one. Because of that, I wanted to talk a little bit about those. You need to be aware so to make sure that you are making an informed decision. Condoms, while they prevent STDs, which no other form of birth control does, they have decreased effectiveness. Like we said, 18% of the couples using them over a year will end up with a pregnancy. Lambskin condoms, it's also worth noting, don't prevent STD transmission. Sperm can also leak from a condom, and condoms can fall off and cause issues like that. Oral contraceptives, while they're 99% effective, in real life they're only about 91% effective. This is because women forget to take them on a daily basis. They sometimes miss prescriptions, and whenever taking it with other medications such as antibiotics, it can inhibit the birth control. They can also cause symptoms whenever you're starting, such as headaches, nausea, sore breasts in the first few months of use. It can also make an individual slightly more at risk for blood clots, according to Planned Parenthood's birth control fact sheet released this year. These are all things you should discuss with your doctor if you're worried about or if you're susceptible to blood clots. IUDs, while they're the most effective form of birth control, are expensive. Many women can't afford them without health insurance, and even with health insurance, they can be over $1,000. They also have higher rates of side effects. They can lead to irregular periods, heavier periods, and spotting in between periods. They can also cause pain upon insertion. A lot of women experience cramping for days to weeks following the insertion. These are things you need to discuss with your doctor and be understanding that these things can happen to you. And as well as if you've already had one placed and you're having these side effects, to discuss it with your doctor. So we've discussed today the importance of birth control, the statistics behind who needs better access, as well as the forms of birth control and the things that you need to be considering. We want to understand the different types because it makes you available for more informed and prepared for safe sex. In closing, unplanned pregnancies are more prevalent in those young who are less educated. There are multiple types of birth controls available, but there are side effects and things that you need to be aware of whenever you're using each type of birth control. So the last thing I want to leave you with, according to the Cost of Raising a Child by economist Mark Leno from the USDA, released in 2017, raising a child from 0 to 18 years costs around $233,610. That is short of without paying any for college. So next time you're considering the worthiness of birth control and whether it's worth the cost, remember that raising an unplanned pregnancy is much more expensive. Thank you.